Good morning. My name is Andrea Kroll. I'm a psychiatrist at Emory. I work mostly at the outpatient clinic at EP12. If you have any questions after the presentation today, please feel free to email me at my email address here. And I'm going to talk to you about anxiety. Hopefully this won't take much more than 5 minutes. Uh-oh, my slides are not forwarding. There we go. I do want to point out a couple of very quick resources that are available online for you to use. There's a web page dedicated to wellness guides. The website is right above at the top of your slide there, and that connects to a number of different tip sheets targeted at different populations. So two that I'll direct your attention to are persons who have COVID or expected to have, or suspected rather to have COVID, who are not hospitalized. And that website is highlighted at the bottom of this slide in case you want to go ahead and bookmark it if it's something that's useful to you. The other tip sheet that I would direct your attention to is specifically about anxiety management. This is not specific to patients who are suspected to have COVID or known to have COVID. And again, that website is highlighted in yellow on the slide. So some things that you can do with your patient during the appointments to help manage their anxiety is to, first of all, not pathologize it. It's appropriate to be worried about legitimately scary things. There's nothing, inappropriate or concerning about that. So validating that their worries are reasonable to the extent that they are is a good thing. And help them to see that it will fade over time, that we will get through this. And so in the short term, yes, you'll be worried about it, but this will get better as the situation improves. Some very anxious people will pull you to overpromise or provide unrealistic reassurance, telling them that you're certain everything is going to be fine or you're certain they're not going to get it, which, like in any other circumstance that you're faced with as a physician, you don't know the future and can't make that kind of promise. You can help them to engage in behaviors that will reduce their anxiety and promote healthier coping skills. So some things that you can do actually with them in the appointment includes slow paced breathing and progressive muscle relaxation. Anything that helps them to activate the parasympathetic system, and some people actually like hearing that mechanism, or to release tension is going to be helpful for anxiety relief. And so in terms of slow breathing, it's actually been shown that maximum parasympathetic activation comes with a 12-second breath cycle. So I usually have practice with people 4 seconds breathing in, hold it for 4 seconds, 4 seconds to exhale. Any way of dividing up that 12 seconds is fine and will help to calm the body. You should also screen for unhealthy coping behaviors. So is somebody drinking more or using substances as a way of avoiding those uncomfortable, anxious feelings, or overeating for much the same reason? And then screening also for emergence or particularly reemergence of psychiatric disorders that they might have suffered from in the past or that they might just not be able to be resilient to in the present circumstance. So is this actually a major depressive episode? As opposed to, are they just struggling a little bit specific to the environment? Some things that you can use if you feel like medication is appropriate for your patient. Sorry if you can hear my dog in the background. One, and this is not specific for COVID patients, but people who are just worried about contracting COVID, and every time they have any kind of respiratory symptom, they call you because they think, well, now I definitely have COVID. Just if it could be allergies, given how much pollen is in the air lately, treat those more aggressively. It might not be that the person has significant anxiety or significant allergies rather, and they maybe normally don't take medicines, but anxious people become very somatically preoccupied. So if there are like safe ways to manage some of those somatic symptoms, that can just really help you. In terms of sleep, if that's the primary complaint and they're just not able to fall asleep because they're worrying, you can try some gentle over-the-counter medicines like Benadryl or melatonin, particularly in younger folks. Trazodone, anywhere from 25 to 200 milligrams is very safe, and also you can use the TCAs at low doses. The main thing to think about is just in the older folks, the use of anticholinergics. A really nice alternative to anything with a lot of cholinergic activity is mirtazapine. I use that a lot in the elderly. You can start at 15 milligrams at night. That can be every night or just as needed for sleep. Over the long term, it tends to induce weight gain. So great for older folks or people who are so worried that they're not eating, but tends to kind of backfire if you give it to young women. They get really mad because they put on pounds. Vistaril is another option, but again, very anticholinergic. Buspar is a nice, gentle option that you can use kind of PRN at low doses. It's usually not that effective, but can be for this particular situation, people who don't have a lot of anxiety at baseline. You can also start at 7.5 twice a day and titrate from there. I do want to mention quickly just self-care, that being around anxious people will make you anxious. That's not a problem, that's normal. That means you're a human being. And so just try to notice if you're getting more tense, if your heart rate is going up a little bit, and engage proactively in behaviors that are going to help reduce your own anxiety. So that could be a daily breathing, a slow breathing practice, or a meditation practice. Also just short trips, anything that disrupts kind of that tense state that you get in when you're with a lot of tense, anxious people all day. So take a quick walk around the block if you're working from home, or up and down the hall if you're in the office. And like YouTube videos actually are great, because if you can get something that's funny and that makes you laugh, that really breaks up the tension and kind of disrupts that anxious circuit that's being activated, and can just help you move on to the next patient and not feel all that tension yourself. There's some behavioral things you can do for people who are just highly, highly anxious and always calling you. And certainly you're able to, if you have patients like that and you want to call and talk about how you can structure their visits, I'm happy to talk to you about that. I also want to point out that there's a survey, it takes like 3 minutes to fill out, that you'll see here in this QR code in the corner, that will help the psychiatry department to know what services best serve the healthcare workers themselves. And then if you do find yourself in need of support, you can go to this website here at the bottom, Care for COVID-19 Responders Program, which provides support calls and other psychiatric services should you find yourself interested or in need of those things. If you would like to contact me about a patient, feel free to either email me or send me a message through Emer if it's about a specific patient. We're going to have the ability to do indirect consultations, if not immediately, very soon through interprofessional consultations, so we can take a look at your patient's chart and make recommendations without them having to come in, for those patients who just really do not want to come in. And then we'll have a direct consultation service that starts at the beginning of June, where you can refer your patients and they might only come in one time. And so that really helps if they're really against the idea of coming to a psychiatrist, but you're really struggling with medications. And then feel free to please look at the additional resource slides that I've provided that just give you some more information about healthy sleep, healthy routine tips, and then a bunch of apps that people have found useful during this pandemic. So thank you for listening. I hope this was helpful. Feel free to contact me with any questions. Bye.